Mr. President, I rise today in opposition to President Trump's nomination of Congressman Tom Price to the Department of Health and Human Services. The department he has been picked to lead is charged with protecting the health of all Americans, from safeguarding Medicare and nursing home care for seniors to investing in medical research and supporting public health programs such as lead poisoning prevention and youth suicide prevention. Unfortunately, Congressman Price has demonstrated over the last decade in Congress that he is unwilling or unfit or both to protect these critical health programs. In his role as chairman of the House Budget Committee, Congressman Price has authored plans to repeal the Affordable Care Act and to turn Medicare into a privatized voucher program. This is the opposite of protecting the safety net programs for our most vulnerable citizens. Time and again, Congressman Price has proven that he favors corporate interest over patients, which has raised ethics concerns. And for these reasons, I will oppose this nomination. First, I'd like to talk about the Affordable Care Act. About a month ago, I was here talking to my colleagues on the floor about the impact of the ACA in my home state of Rhode Island and the consequences of repeal. In short, repeal of the ACA would be catastrophic in Rhode Island and across the country. Yet Congressman Price has led the efforts in the House of Representatives to repeal the ACA without any replacement. In fact, he is the architect of legislation to do just that. The uninsured rate today is at its lowest point in recent history, and that holds true in my state of Rhode Island. The uninsured rate there has fallen from nearly 12% to under 4.5%. That translates to over 100,000 Rhode Islanders who have gained coverage because of the ACA. And while it's not the case in every state, in Rhode Island, insurance rates have dropped. In fact, consumers in Rhode Island have saved $220 million since 2012. We cannot go back to a system that allowed private insurers to deny coverage for pre-existing conditions or charge more to those who need insurance the most. By contrast, Congressman Price opposes the pre-existing conditions ban, one of the most popular provisions of the ACA. His plan would allow insurance companies to deny coverage or rather charge more to those with pre-existing conditions, older Americans and women. He has also proposed getting rid of the essential benefits package in the ACA. And these protections require insurance companies to cover things like prescription drugs, maternity care, pediatric services, and mental health care. These are really things that any basic health coverage should include. Yet Congressman Price has advocated taking away these consumer protections. And stop and think about that. Congressman Price doesn't think that health insurance should cover pregnancy, for example. I mean, we're not really talking here about extravagant services. These are the services a reasonable person would expect their health insurance to cover. In fact, Congressman Price's plan, the Republican plan, to repeal the ACA would mean that nearly 500,000 Rhode Islanders with pre-existing condition, and that's nearly half the population of my state, could be denied coverage or charged more. And those who might still be able to get coverage would quickly find that it doesn't really cover that much. These consumer protections that are embedded in the ACA affect everyone, not just those who have coverage because of the ACA. Before the ACA, the Affordable Care Act, insurance plans, including coverage through your employer, could impose annual or lifetime limits on coverage, meaning coverage could end just when you need it most. With Congressman Price in charge, we will see, if he has his way, a return of these limits, even for employer-sponsored health plans. Now, the nominee's stance on the Affordable Care Act is not my only worry, because when it comes to Medicare and Medicaid, benefits that Americans have worked hard to earn and to fund, Congressman Price's views are far outside the mainstream. Medicare is one of the great success stories in expanding access to care and keeping seniors out of poverty. Since the passage of Medicare in 1965, we have seen significant decreases in the numbers of seniors living in poverty, and this is largely because of Medicare and, of course, Social Security, another critical safety net program for seniors. I believe that Medicare is essential for the quality of life of Rhode Island seniors and for seniors across the country. In fact, I supported the ACA because it made key improvements to Medicare that strengthened its long-term solvency and increased benefits such as closing the prescription donut hole and eliminating cost sharing for preventive services such as cancer screenings. Over 15,000 Rhode Islanders saved $14 million on prescription drugs in 2015, an average of $912 per beneficiary. And in the same year, over 92,000 Rhode Islanders took advantage of free preventive services, representing over 76% of beneficiaries. They received these benefits because of the Affordable Care Act. Repealing the Affordable Care Act, as advocated by Congressman, means repealing these benefits for seniors and shortening the life of the Medicare Trust Fund by over a decade. What's worse is that Congressman Price not only wants to repeal the ACA and the Medicare benefits that come with it, but he has also advocated for privatizing Medicare, turning it into a voucher-based program, as well as raising the eligibility age. Simply put, this would end Medicare as we know it. Millions of Americans, including over 200,000 Rhode Islanders, have paid into the system, counting on the benefits that they have earned and worked their entire lives for. Under Congressman Price's plan, Republicans would shift more costs to seniors who have played by the rules and plan for retirement with quality Medicare coverage. Congressman Price and congressional Republicans tell you that they are trying to cut costs under the banner of trying to save Medicare. If that is the Republican standard, then why did they oppose the ACA, which actually improved Medicare services, cut costs, and extended Medicare solvency? That seems to be a pattern with many on the other side. Act very serious and concerned about Medicare's finances, but then make every effort to demonize and roll back these improvements. In fact, Medicare spent $463 billion less from 2009 to 2014 than expected under growth trends prior to the ACA, all while increasing benefits like free preventive care and better prescription drug coverage, and adding over a decade of solvency to the Medicare Trust Fund. The projected cost, the best projections, were actually lowered by the ACA, while benefits were increased. This talk of supposedly saving Medicare is really, in my view, a ruse to make draconian cuts to free up more federal funding for things like tax breaks for the wealthy. And we cannot allow Republicans under Congressman Price's leadership to go back on the Medicare guarantee we have made to seniors that we represent all across this country. And Congressman Price has also made a number of troubling statements about Medicaid and the Children's Health Insurance Program, CHIP. First, repeal of the ACA would have disastrous effects on state Medicaid programs, kicking 11 million Americans off their health insurance, including 70,000 Rhode Islanders. However, this is not enough for Congressman Price. He has authored legislation to cut Medicaid even further, to the tune of $1 trillion by turning Medicaid into a block grant program. Now, I think my colleagues should really consider how this would impact their states. Including those newly insured by the ACA, Medicaid covers 74 million Americans. Now, who makes up this population? Well, half of the Medicaid enrollees are children. Medicaid also pays for half of the births in this country. These are staggering numbers. In Rhode Island, 1 in 4 children are covered by Medicaid or CHIP, and 1 in 2 people with disabilities are covered by Medicaid. And while Medicaid was initially designed to help low-income families, seniors now account for approximately half of Medicaid spending nationwide. Nearly 60% of nursing home residents are covered by Medicaid across the country, and that holds true in my state of Rhode Island. And many of these people are our neighbors, our friends. They've been working all their lives, and they've qualified for this coverage because they've been able to move some of their assets out of their own ownership because of our rules don't recognize retirement accounts. And so these are our neighbors. And so when Congressman Price talks about turning Medicaid into a block grant program, every member of this chamber should stop and realize that there's no way to cut Medicaid by trillions of dollars without harming children and seniors and placing each of our states in a very difficult position, because they too contribute to Medicaid, because they have a responsibility to children and seniors for health care, because they do also help support nursing home and nursing facilities for seniors and the disabled. And they would be in a disastrous situation. Now, all of these are, I believe, are reasons enough to oppose Congressman Price's nomination. However, and I alluded to this earlier, and Senator Wyden went into great detail. Congressman Price has a history of conflicts of interest, such as investments in the very issues and companies he worked on in his role as a member of Congress. Congressman Price traded hundreds of thousands of dollars in health care and pharmaceutical stocks, all the while advocating for regulation and legislation that would financially benefit these very companies. And again, Senator Wyden has made a very detailed and very persuasive case in this regard. In fact, as again, Congressman Wyden has pointed out, Senator Wyden rather has pointed out, after receiving information for a fellow congressman and now a member of President Trump's transition team, Congressman Price was one of a small group who was offered the chance to purchase stock in a biomedical firm at a discounted price. And now, while Democrats have not been allowed the opportunity to fully examine these issues, I find the examples we do have to be deeply concerning. And the very articulate, eloquent, and detailed, exhaustively detailed statement by Senator Wyden adds further credence to this presumption. And this is a very disconcerting pattern of behavior. And indeed, I believe this pattern of behavior warrants further investigation, but those requests have been denied by the Republican majority. These allegations are even now more concerning because Congressman Price is being considered for the top role in this administration in charge of protecting the health of all Americans and indeed affecting the corporate situation of thousands of companies throughout this land who he may or may not have a financial interest in. Now, I've heard from hundreds of Rhode Islanders who have expressed these concerns to me, from his support for the efforts to repeal the ACA and cut Medicare and Medicaid to his questionable investments, and I agree with him. As such, I am unable to support Congressman Price's nomination to be the Secretary of the Department of Health and Human Services, and I would urge others to look very carefully at the record, carefully at his advocacy for the elimination, basically, of Medicare as we know it, of block granting Medicaid, which would harm children and seniors and put excruciating financial pressure on every state in this country, and his own behavior with respect to personal investments. And with that, Mr. President, I would yield the floor. I would note the absence of a quorum.